Hey everybody, this is my guide to what is microcephaly. Microcephaly is a rare neurological condition in which an infant's head is significantly smaller than the heads of other children the same age and gender. It can be present at birth or may develop postnatally. There are many different things that can cause microcephaly, such as decreased oxygen to the fetal brain, chromosomal abnormalities, exposure to drugs and/or alcohol in the womb, or severe malnutrition during pregnancy. It can also be caused by infections during pregnancy such as HIV, Zika, rubella, or herpes. Some defining features and characteristics of microcephaly. The head size that is significantly smaller than the heads of typically developing children, small head, large face, receding forehead, and loose wrinkled scalp. Microcephaly is not a common condition. In the United States, the prevalence of microcephaly ranges from 2 to 12 in 10,000 live births. Children born with microcephaly may develop epilepsy, cerebral palsy, learning disabilities, hearing loss, or vision problems, while some children develop normally. The effects on development. Microcephaly can affect children in different ways. Some children may experience a variety of delays in development, while others may experience only a few or none. Effects on development include, but are not limited to, social-emotional development, trouble making and keeping friends, minimum social interactions, lack of dependence. Literacy and language. Difficulty expressing his or her wants and needs and communicating. They also may not use or understand appropriate forms of speaking. Cognitive development. Low concentration span, learning disabilities. Physical development. Fine and gross motor delay, developmental delay, clumsiness, and prone to seizures. Sensory hyperactivity. Educational implications. Collaborating with teachers, specialists, and therapists is important to ensure a good and equal education. Inclusion allows for children who are receiving special education services to learn with their non-disabled peers in a general education classroom. There are many ways that a teacher can support a child with microcephaly in the classroom. For example, teachers can break down ideas or tasks into smaller parts. They can say directions multiple times, use the child's name to gain attention, or allow them extra time to complete tasks. The use of positive reinforcement in the classroom can also be effective. Cultural implications. Microcephaly is prevalent all around the world. In recent years, it has been in the spotlight due to Zika virus. However, treatment is the same. Since there is no medication for microcephaly, we must rely on prevention and early intervention and services when they are available. While some cultures may not believe in the services, it is important to have open communication with your doctor and other professionals. Having a child in special education services can be confusing and intimidating. For families who do not speak English as a first language, the use of an interpreter is important to effectively communicate with the teacher. There are many resources that can be found about microcephaly. There are several websites such as Foundation for Children with Microcephaly, Center for Disease Control and Prevention. There are also many websites such as the Mayo Hospital website and other professional affiliations that can give you a lot of different facts about microcephaly. There's a book that I found, the official parent source book on microcephaly, that can be bought on Barnes & Noble. And then there's an article that I found that was published in the New York Times about a family struggle with microcephaly that had been linked to the Zika virus. And then my source in a different language, I found online a pamphlet in Spanish that talks about the Zika virus and its effects on pregnant women, and that is in Spanish, and that can be used for Central and South American countries.